I love this station.
Joy 99.7 FM. Joy 99.7 FM.
Alrighty. In the seat to make it complete. The name is Nortey by Nature. Program is Ultimate Health, your ultimate guide to healthy living. This and every Sunday, 2:05 indeed. By His grace, we are live. Yeah, sometimes you're driving into the studio and you're driving on your way and you got all those Sunday drivers, and indeed you are late. Let's still do a little inspirational song. Michael Bolton says, "Lean on Me." Something changed. I've been in here since last year. Gracefully, we crossed over 2025. We're still alive. You were on the makeup list, wake up list, I should say. All right, I'll skip my lean on me. I'm leaning on Ziggy at the moment. But hey, this year, we thought, let's get in there and start something new. Let's give birth. Today, I have an old friend of the program, Dr. Paddy Ayete. Consultant obstetrician gynecologist. Now he's with Elimas Health. We're looking at achieving conception. Yeah, some people do it unskilled labor, right? other people have a challenge. So what are the things you should know if you seriously, 2025, you want to have a baby, you want to conceive? Hey, listen up, sit up. That's why I've got Dr. Paddy Ayete in the studio. We'll look at a range of things. And over the next couple of weeks, we'll have a range of professionals and disciplines to equip you with everything you need to know. Doc, it's been ages.
Yes, indeed.
Wow.
Afternoon, and I'm glad to be here.
When's the last time we had you?
It's been quite a while.
Wow. Did you desert us? Did we desert you? Or,
Well,
you've been busy.
I've been busy.
Wow. You've been busy. And then, a few weeks ago, I was thinking and I remembered there was a lady who came to see me professionally, and she had a challenge with a fibroid. And she was scared stiff from the church or spiritual angle. She was scared stiff. I did all my part of the job. And I suggested that she come see you then. Okay, then you were working under a different business name. And that was the last I saw of her, Paddy. Then several years down the line, I'm still in my office then in Yaneba, and I was getting into the car or getting out of the car, but a car passed by and reversed. The window came down and said, "Is that Nortey?" I said, "Yes, it is." Then she says, "Oh, let me park." So she pulls into the car park, and we go into my office, and she's followed by what then looked like a 6 or 7 year old girl. Says, "So you might not remember me. I came to see you, blah, 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 the challenge, fibroid and visits, and then, of course, fertility issues. But this is the outcome of your advice."
I see.
The 6, 7 year old girl in her school uniform, right?
Nice.
And I was like, whoa. And she had indeed proceeded on my advice to see you, and I think she did have the fibroid removed.
Yeah.
And short story. So we are glad to have you,
Thank you very much.
right? So folks, if you may not have heard him on this show for a long time, yes, he's a consultant obstetrician gynecologist. He's a member of the Fertility Society of Ghana, FESOG. Indeed, he's the secretary, right?
Yes, I am.
Is he secretary or secretary general?
General Secretary.
Okay, I'll pretend I'm not a member. All right. And he specializes also in what? Minimally invasive
Invasive
surgery.
And,
Is that
and PCOS and fertility.
fertility and all that? So we want to look at how to conceive and how to achieve that miracle. Okay, the ultimate, should I say, maker has designed us, equipped us with the software, the hardware, and everything that should make this possible, even if you close your eyes or did it accidentally. Paddy, am I right?
Yes.
Okay.
Accidents happen. And
Right. Okay.
in fact, half of all pregnancies are accidental.
Oh, Charlie.
Aquintia.
Okay, right. But we want to start considering the what you should know. Okay, so let's cut the biology class down a bit. So when we say conception, what exactly are we talking about before we look at what is needed? What is conception?
Well, essentially, we are talking about getting pregnant.
Right. Okay.
So we are trying to get pregnant. And there are several steps in the journey.
Okay.
Some of which we know, some of which we not necessarily know. But if you're educated about it, it makes a big difference.
Okay.
In that process.
Right.
It is. I hope that we are starting the year well, and for all those who have decided that this year they will get pregnant, we shall put them on the right path.
Conception 2025.
Yes, conception 2025.
All
They
right.
shall do outdooring 2025.
Okay. Right. We receive it via 99.7 FM.
Amen.
So I mean, biologically, right? What really happens before we can say you've taken seed?
So essentially, the man produces a sperm.
Okay.
The sperm is in his ejaculate, and then during intercourse, the man ejaculates into the vagina. The sperm ascends from the vagina all the way up to the uterus.
Okay.
So through the vagina, through the cervix, which is the opening of the uterus, what you feel when you put your finger inside.
Okay.
And then into the uterus, and then goes to where the corners of the uterus, there are two holes there that lead into tunnels,
Okay.
what we call the tubes. So the sperm now goes into the tubes where it meets the egg in the tube.
Okay.
The egg is released from the ovary. The woman relieves 1 egg
Okay.
every month, occasionally 2. And when we get involved, sometimes 10.
Right.
So the ends of the tube have some finger-like projections. They're called the fimbriae. They grab the egg and pull the egg into the tube to meet the sperm.
All right.
The sperm and the egg meet in the tube. The sperm enters the egg and then fertilizes the egg, becomes a baby.
Okay.
The newborn baby or embryo now travels from the tube and goes into the uterus.
All right.
Where it lands on the lining of the uterus, digs its way into the lining of the uterus so it can get food.
Literally
Implants,
itself.
or what you call
Right.
implantation.
Right.
And then a pregnancy starts. So
Okay.
we do a pregnancy test then, and we say that we find a pregnancy hormone in your urine or in your blood and tell you that you are pregnant.
Okay.
That is the process.
Right. Simple. Tetia. Agbena.
That is how it's supposed to
That's
be.
how it's supposed to be.
Yes.
So we have the required or requisite constituents, the sperm and the egg.
Yes.
They must have been produced somewhere.
Yes.
All right.
Yes.
And properly so.
Yes.
Okay. And then this whole journey, the introduction of the sperm, right? And its travel into the meeting place.
Yes.
The event center, which you tell us is a tunnel. All right. And then, of course, the egg must have been produced properly, released, and also make its way to parliament. Right?
Where they shall meet.
Okay. They meet, and then certain things take place. If those things are successful, then the fertilized egg, can I call it that then?
Yes.
Moves and implants itself.
So it moves from the tube back into the uterus.
All right. So it's not supposed to stay in the tube.
It's not supposed to stay in the tube.
All
If it
right,
stays in the tube, it becomes an ectopic.
All right. Okay. You see, anytime I have, whether it's Michael McCarthy or Paddy Ayete, every sentence yields a new program, right? So please don't get derailed. We are focusing on achieving conception, and we have said and underscored that this can happen naturally, right? Whether you wanted it or not. Indeed, he says a huge, significant percentage are accidental. You know, the one that you say, oops, right? But there are times when there's a challenge to this. And there are also optimum, or should I say optimal, I need to check my dictionary, right? Conditions that make this more likely to happen. So if we are interested in making sure this happens, then that's why we're talking about what you need to know to achieve this, right? And hopefully we are also, should I say, assuming that it is wanted.
Yes.
Okay. So wanted pregnancy, wanted conception.
Yes.
All right. Okay. So if we were talking about, a deliberate, curated effort to make sure this happens, what are the immediate considerations that you want to introduce? We're still just discussing.
Yeah.
Okay.
So if you decide you want to get pregnant this year, there are a couple of things that you need to do in the early stages, or the moment you decide that I intend to get pregnant.
Okay.
One of them, you want to ensure that you are in good health.
All right.
So if you are overweight, for example, it's a good idea to start working towards losing weight.
Okay.
Excess weight
Right.
makes your hormones have a lot more work to do and make it more difficult for you to be able to get pregnant.
Okay.
If you have any chronic illnesses, hypertension, diabetes, sickle cell, any kind of condition you might have,
Right.
Lupus, anything, it's important that you ensure that you are under control
Okay.
before you get pregnant, because pregnancy tends to make a lot of conditions worse.
Right.
So if you are starting your pregnancy off with a high blood pressure, almost certainly you will not get to the end, because the pressure will even go higher at a particular point in the pregnancy.
Okay.
And the result may be that your pregnancy will not, either the baby may die or you may lose the pregnancy before
Right.
time, or your life may be in danger, and because of that, the baby has to be removed, because the only solution is baby comes out
Right.
to save your life. So if you are diabetic and your sugar levels are out of control, diabetic patients tend to have an unexpected or unexplained fetal deaths.
Right.
Everything is okay, sugars are a little bit misbehaved, they just go up a bit, then the baby dies.
Okay.
So it's really important you get all those under control.
Everything that may be pre-existing, hopefully known.
Yeah.
If not known, checked.
Yeah.
Right.
So-
Investigated.
So for that, because they are unknowns, it's a good idea to have what you call a preconception visit. You see
Okay.
your doctor, you explain that I intend to get pregnant. He then checks some of these things. So your blood pressure, your sugar levels, if you've got clotting problems, all those kinds of things, just to make sure that you are in fairly good health.
Okay.
Before you embark on that journey, because pregnancy is very taxing on the body.
Okay.
And then, in addition to all that, what you can do for yourself is you start taking folic acid. We want you to take folic acid because it prevents a condition what you call neural tube defects.
Who's taking this? Male,
The lady.
female? Okay.
Yes.
Female.
Yes. So it ensures that your risk of neural tube defects is reduced.
Okay.
So folic acid is like a big deal.
All right.
And then we also want you to stop drinking alcohol, because the alcohol affects the
Completely.
preferably completely.
Okay.
And then reduce caffeine.
Right.
It has been found or suggested that drinking more than 2 cups of coffee every day, or for that matter, even tea, can reduce your risks of having a baby or a pregnancy.
Okay.
Those parts are a little bit, they're not like hardcore,
Contestable, but
they're a bit contestable.
related.
But it's a good idea to ensure that the amount of chemicals you put in your body are as reduced as possible.
Okay.
And that also goes for like over-processed foods.
Okay. Right. 20 minutes past the hour of True Ultimate Health on Joy 99.7 FM with me, Nortey by nature. I'm in the good, great, should I say, qualified company of Dr. Paddy Ayete. He's an obstetrician, gynecologist, and fertility specialist. He also specializes in minimally invasive surgery, assisted reproduction techniques, and many other things. He's the CEO and medical director of Elimas Health. They are at airport, right? Just as you go past the turning to Volta Street, yeah, you see it on that road. A very busy place. Many of you, if you know Uncle George, the watch repairer, many people know him. Yet the next gate is Elimas. They also have a new facility. Is it that new or it's new to me?
It's new.
It's a new facility. Community 18 Elimas, a green
Green and white building.
green and white multi-story building. He's been busy. He's given birth to another center. We're discussing how to achieve conception, right? Do's and don'ts, things you may or may not know. He's just underscored the importance of your overall health status, both male and female. Right, you should know your numbers if you're diabetic, if you have any chronic or pre-existing, hopefully known conditions. They should be under full, monitoring and control. Right, he's mentioned diabetes, he's mentioned a few other things that may impact on your chances of achieving successful, viable conception. All right, we'll be going through the steps. WhatsApp is 055 11 11 997. Shortly, I will activate those phone lines so that you and I can conceive, right, in terms of the issues that we need to discuss. So we have Dr. Paddy Ayete here. So let's move on. You mentioned a pre-conception consultation, right? At this stage, how far advanced is pre? When should I start the pre? And also add on to that, at this stage, am I seeing a specialist? I may have my doctor already, okay? You are suggesting that I notify my provider or my physician of my intention to
Yes.
have a child
Yes.
or to get pregnant.
Yes.
Okay. To many people, Charlie, this is private too. I come to you when I'm pregnant. Please explain that step.
Oh, I do have quite a number of patients who come and say, I intend to get pregnant and,
Okay.
and I just want to come for a checkup. Which was initially a bit odd because in this country, people tend not to do that.
Okay.
But more and more people are just walking in and say, I intend to have a pregnancy. I want to make
Alright.
sure everything is okay with me.
Okay.
And you don't necessarily need to see a specialist for that visit.
Okay.
The preconception visits can be handled by most doctors.
All right.
But essentially, we are trying to assess how good is your health.
Okay.
We haven't yet decided that you have a problem.
All right.
And if we check the general parameters and we think that you are in fairly good health, then yes, you can attempt a pregnancy.
Okay.
If you don't succeed in getting pregnant, then it's important that you see a specialist.
Okay.
Because then there are more things that need to be done in your case.
Okay.
If you can have that visit 3 to 6 months before you intend to
All right.
to get pregnant, that would be great, because for a number of conditions, it may take you about 3 to 6 months
All right.
to get it pretty stable, and
Okay.
then your chances become pretty good.
Okay.
So that's kind of
That sounds good. So 6 months in advance tells me this is deliberate.
Yes.
Okay. This is not accidentally on purpose, right? So what if, oops, Dr. Ayeti, I'm already in the game and there's something in the oven, right? It means that I have sidestepped or skipped these pre-conception stages. Can I still come to
Yes,
you?
you come immediately.
Immediately.
Yes,
Right.
we in the olden days, I think they tended to go to the hospital later because you wanted to, I don't know, make the pregnancy grow first or something.
All right.
It's better that as soon as you realize you've missed your period, you see a doctor,
Okay.
and they would run certain tests for you to have an idea as to, if you had a preconception test, we are happy. It means that we know that you're in good health before you got pregnant.
Okay.
If not, then we start having to look for problems. So
Right.
I'll give you an example. A woman who has irregular menses is at risk of, in fact, tends to have a condition called a luteal phase defect. The end result is that she doesn't produce enough progesterone.
Okay.
That would mean that once she gets pregnant and the pregnancy gets to a certain stage, she'll start bleeding,
Okay.
because she doesn't produce an adequate corpus luteum to produce adequate amount of progesterone to allow the pregnancy to stay.
Okay.
So she starts bleeding early pregnancy. So there are women who are walking about who, when they get pregnant, they start bleeding like after 6 weeks,
Okay.
or maybe even 8 weeks or even 5 weeks, and then they bleed and lose the pregnancy.
Right.
And it keeps happening repeatedly. Those people have a particular hormone defect.
Okay.
And it's important that you check their levels and say, you're pregnant, we test you. Preferably, I would like to fix you before you got pregnant.
Right.
In the event that you come to me late and I see that you have that problem, then I start chasing. That means
Okay.
you are playing catch up.
Okay.
We don't like playing catch up.
All right.
It's difficult. If you anticipate it before, you fix the reason why she has the luteal phase defect. By the time she gets pregnant, you support her.
Right.
The pregnancy stays.
Okay. Great stuff. So, folks, you're hearing this in our discussion on achieving conception, getting pregnant 2025. Dr. Paddy Ayete and I have conspired that if we have willing people, hopefully in commitment-based relationships, proper unions, and looking at having a child, there are certain considerations that's what we're discussing on our first program for 2025. We want to give birth, right? So if you have any questions, concerns, 055 11 11 997, that's the WhatsApp. And shortly I will activate the phone line so that you can, bombard him with your own fertilized questions. Right, Doc, at this stage, right, you're saying that, well, if I did properly do this, hopefully 6 months or more before conception, consultation, if there was a hormonal defect like you just talked about and it can be reversed, then the processes and steps will be undertaken to reverse it. Also, just adding this to this question, also you're also telling us that achieving conception itself can be attained. We can achieve it, but we must be able to hold that.
You can attain,
You can attain,
but you have to maintain.
you must maintain.
Yes. It's
And
like we are discussing an erection.
You see
Attain and maintain.
hey, Doc,
Same thing.
you want us to go to Hebrews?
Urology.
But I know what you're talking about.
Yes.
Okay, so the erection is there, but it must be sufficient.
Yes.
Okay, if it goes away premature,
Precisely.
All
Same
right.
thing.
Achieve, attain,
Yes,
maintain.
maintain.
All right, please. This program is not about erection. I know you people. All right. Now, so there are conditions precedent
Yes.
and conditions subsequent, right?
Yes.
So I must be in a certain condition to attain the conception.
Yes.
As to whether it will survive, as to whether it will be viable, a term I picked up many years ago talking to Dr. Hiaji, right? We did a whole series in them early days,
yes.
okay? Right? Viable, which means it will survive,
Yeah.
right? And then you have a successful pregnancy, hopefully with minimal problems and so on and so forth. So you are looking at all of these things. One, in an anticipatory mode, and then also when conception has taken place.
Yes.
You are monitoring all of these
the
things.
Yeah.
All right. If you have any questions, concerns, WhatsApp 055 11 11 997. And let me activate those phone lines. And sometimes they derail us a bit, but they are part of the show, part of the pregnancy. If you come with any challenges, we'll fix you. All right. So the phone line 0302 216541 0302 216541. This is Ultimate Health on Joy 99.7. We are achieving conception 2025. Okay. Yes, you can go for your prayers, and maybe you've been doing it unskilled, accidental, but now maybe it's not happening, and you want to top up. This is the program you should be listening to.
Joy 99.7 FM.
Okay. I guess perhaps validly or rationally, logically so, there seems to be a bias towards the woman, the status of the woman, the health status of the woman. Is there anything in this preconception phase that we want to direct at the men? Right? Because you're saying check yourself, and we did say it initially, right, as an introduction, well, the sperm must be produced, it must be in good shape, whether size, morphology, and all those things, motility, and all those that will come in later. But what would you be saying to the men? Because they're probably calling the women, Betty, Nortey, conception, right? The bias is valid, but preconception, what should the men be thinking in?
The men have similar. Actually,
right.
we don't usually ask men to be taking folic acid, but if they smoking causes the sperm motility to be significantly affected.
Its ability to move.
Its ability to
swim,
yes,
run, compete.
That's cigarettes.
Okay.
Smoking weed affects sperm production itself.
Cannabis, ganja, tampi.
It also affects sperm production itself. Excessive drinking of alcohol.
Okay.
Also affects it. So there are similar things. And for men especially, you have to add sleep, getting enough sleep, and then allowing themselves to have enough ventilation around the testicles.
Down there.
Because too many people have got ovens there instead of air-conditioned rooms. And we want the place to have... There's a reason why the testicle is not in the body, but out of the body.
Suspended.
Indeed, those whose testicles remain in the body end up having at a high risk of having cancer of the testis.
Right.
Because it's not supposed to be in a hot environment.
Okay.
But once it is out, then it's allowed to be in the temperature it's supposed to be to allow it to produce.
So this is a
properly.
checklist for the men. Right.
So for the men,
Good.
They need to be sure that they are that they are living a healthy enough life
right.
to be able to produce. Now you must also remember something about sperm. It takes 75 days to produce new sperm. So the sperm you see today, production started 75 days ago.
All right.
That means if you were ill 75 days ago, your sperm now may be faulty.
Okay.
Because production was affected at that time because you were ill. So it also means that to fix sperm, it takes 3 months to a year to get sperm to improve.
And you're saying that on the assumption that we've actually identified the problem with the factory.
Yes.
Okay.
It takes 3 months to a year to get the sperm to improve.
Okay.
So,
and even that, you are assuming that I'm not smoking, I'm not doing the weed, I'm not doing all the things down there between my lagwate ties.
Yes.
It's not an oven.
I had a client who he said they want to get pregnant. They had tried to get pregnant. There was the pregnancy.
Okay.
So I'd seen the wife giving her some treatment. Then the man, for the first time, tells me that okay, they want to get pregnant, but they want to start in 3 months. And I'm like, why don't you want to start now? He told me he's been smoking.
All right.
He wants to stop smoking for 3 months.
Okay.
Before they try for the pregnancy.
Okay.
He did stop smoking. They tried. She got pregnant, and she has a lovely baby boy.
Wow.
Not many men would come forth and say this is what their plan is, but in actual fact,
but they'll pay for her consultations.
Yes.
Right.
So it's important that even you, the man, should also decide that hey, this is what we are going to do. And if she is doing her stuff, you are also doing your stuff to try and be as healthy as possible.
Okay.
We haven't gotten to testing yet.
Right.
It is just, I intend to get pregnant and I'm trying to be in the best health shape that I can before we try to.
All right. 32 minutes past the hour of 2 on Joy 99.7 FM. The program, as always, on a Sunday afternoon. Yes, even in 2025 is Ultimate Health. Ultimate Guide to Healthy Living. This and every Sunday, 2:05, we are live. And we make sure we bring you all the top-notch professionals, practitioners, you name it. Whichever paradigm specialty they are operating in. We'll bring them, we'll talk to them, and then you get to ask the questions as well. My phone line active now, 030-221-6541. Don't take it for granted. 030-221-6541. WhatsApp is 055-1111-997. I have in the seat Dr. Paddy Ayete, an old friend of the program. I've gone to resurrect him because this year we want to give birth, 2025, achieving conception. We're looking at the conditions that need to be there to maximize your chances of success in this area or realm where some people are doing it by height, as a friend of mine would say. Some people are doing it accidentally. Some people even want to prevent them from achieving conception, right? So we brought him in. He's a specialist in fertility issues, and of course, if you do fertility, you do infertility as well. Assisted reproductive services or strategies and techniques are available, but you need to have been assessed. He's saying that before, way before you plan to get pregnant, there should be a preconception consultation. At that level, you may not require to see a specialist, but if some things are flagged, then you may be referred to see a specialist. Some of these interventions may be critical in determining whether you will achieve a pregnancy. I have somebody on my line. My line is fertile. Hello. Oops. Please call us again, right? So there are things that should be there and should be monitored over time. We've, underscored the need to maybe be biased or prioritize the women, but he's also giving us a checklist, a pink sheet that should be collated by the men. All right. Are you in good shape? Are you engaging in detrimental habits as far as this scenario and this discussion is concerned? And have you presented yourself for, investigation, at least at the preconception level? Okay. We need to collect and collate all of those things at your polling station as a man, right? And Dr. Aite is underscoring that. Are we done with the men?
Essentially, that would allow them.
Do they typically present with their partners at this level where you call it preconception?
A lot of times, no. The lady comes
Right.
on her own and says, "I intend to do this."
Okay.
And
then you issue a mandamus.
when on the other hand, when they have difficulty in getting pregnant,
All right.
that one they tend to come with the men.
Okay.
Yeah.
Right. And they are comfortable during this consultation?
Yeah, we have a conversation and we try and explain to them.
Okay.
So if there are difficulties in getting pregnant, half of the problem is usually from the man.
Okay.
Half of the problem is from the woman.
All right.
There are three potential problems with the woman. Is she able to ovulate? Can her uterus carry a pregnancy?
Okay.
Are the tubes working?
All right.
So those are the three major big things,
Okay.
and they're related things to that.
Okay.
For the man, it's just does he have the right number of sperm and the right quality
Okay.
of the sperm, and those are the tests that we do. The man's test is quite easy. It's produce sperm,
All right.
and we look at it on the microscope.
All right.
We give it an obstacle course and see if the sperm can achieve
All right.
success on obstacle course.
All right.
For the woman's case, it's a lot more different. We need
Okay.
to do blood tests at the beginning of a cycle, the middle of a cycle, and like towards the end of the cycle.
Okay. All right.
Just
Doc,
to find out all this.
Okay, let me just take this caller. Hello.
Hi. Good afternoon.
Good afternoon. Who am I speaking to and where are you calling from?
Sophie, I'm calling from East Legon.
East Legon. Okay. Go ahead.
Okay, so two things about genders of children. Who determines it? Is it a male or female?
We are achieving pregnancy.
Yeah.
You read gender. Okay, go ahead.
I know why I'm asking. It's for a very good reason. Okay. You see, I know personally. I know that it's men, the sperm that determines the gender of the child. However, women tend to be the victims when a male, especially when you live in a typical Ghanaian home, when a male is not coming, they tend to victimize the women from acting. That is the man who determines. It's the man who determines whether it's a male or a female.
Okay.
So I would like for the doctor to mention it and further educate. And also another thing, secondly, the sperm, when there's an intercourse and you ejaculate for the first time, let's say you do it multiple times within a day, does the subsequent sperm...
We lost the subsequent sperm.
The subsequent. Okay. So basically, right, he's talking about
Simple and straightforward.
Yeah.
A man.
Can
the
I just
sperm-
quickly take this call and then come back to
Okay.
you, Doc? Yep. Hello.
Hello, Nortey.
Hi. Who's speaking?
Oti watching.
Oti, my brother.
I was for the first line in my line.
It cut. I know.
Yeah. Nortey. Yeah, I'm having a plug. Ask the doctor. IVF. They say IVF and the cell. There's a two.
Wait. Hang on. Oti, slow down. IVF. Then you said what? What's the second one?
The cell. I don't want to count the cells. They use the cell to do it for.
The cell.
Yeah, I think one doctor. One doctor. I listened to one doctor. He said they formally they do IVF, but the cost of the IVF is really high. So nowadays they are trying to do the one with the cell.
Okay.
The cell. They use the cell. Yes. I want to ask the doctor what the difference between them, because they told me that the IVF is more costly.
All right.
Than the cell one.
Okay. All right.
About the price, because you want to have it, but the price of the IVF.
Understood, Oti.
Yeah.
All right. Okay. Thank you. Yes. Another caller. Hello. Good afternoon.
Hello.
Yes, sir.
Yeah. Please, I am about the sperm.
No, hang on. Before you get to the sperm.
Hello?
Before you
No,
get to
no,
the sperm.
hello?
Before you get to the sperm, who are you and where are you calling from?
Kofi, I called earlier on my call drop.
Your call dropped.
Yeah,
Okay.
yeah, sure. I wanted to ask that subsequent ejaculation after a first one within a day, can it impregnate a woman?
Are
So
you-
in the same day?
Hang on a
Yeah.
second. Kofi, are you insistent on within the same day?
Yeah, within the same
So, all right. Okay, good. All right. Let me stop Kofi before he ejaculates again. All right, Doc. So, the sexes, right? Let's
Sex
just do
is
that
determined
one.
by the male.
Yep.
The male produces X chromosome, an X sperm, which produces a female.
Right.
So an X sperm, which combine, and the woman always produces an X. Only an X.
Only X.
Only X. So if the male produces an X sperm or a Y sperm, if the X sperm combines with the woman's X sperm egg, it becomes an XX, which is female. If the X sperm combines with a man's Y sperm, if the X egg combines with a man's Y sperm, it becomes an XY,
Right.
which is male.
Okay.
So the sex of a child is generally determined by the man.
Okay, we've gazetted that. Agbena.
That is done.
Right?
Yeah.
And the same way you people learned how to use TikTok and all those things, these things are out there, and I know you know, but there are lots of arguments, and he mentioned the cultural dimension and the blame and pressure and stress put on women, right, for having only one sex of children. Okay, that is done, right? Then he's asking if you have intercourse.
So if you have multiple intercourse in one day, the first ejaculate may fertilize the egg, but maybe they will all miss the egg.
Okay,
The second ejaculate would have fewer sperm than the first one,
okay.
but it is possible for the second, the third, or even the fourth one actually to fertilize the egg.
All right.
So the egg usually lives for 12 to 24 hours.
Okay.
Sperm can live for up to 5 days.
All right.
So assuming you had sex 5.5 days ago, and that's when the first ejaculate was.
All right.
And the last ejaculate was 4 days and 22 hours ago.
All right.
It is more likely that the last one is going to be in a better position to fertilize the egg.
Okay.
Because the earlier ones.
So
would
what's
have
the
gone off.
earlier sperm doing? Press ups?
No, they've got five days.
They're waiting.
They are all waiting. So
All right.
the sperm, they'll all be waiting for
They're
the egg.
there. Right.
And becomes a battle of the fittest.
All right.
And whichever one works is the one that
Okay.
gets
Doc,
it.
let's break it down at the polling station level, okay? Now, you mentioned that the earlier sperm is still viable and still active
Yes.
5 days.
For up to 5 days.
Up to 5
Up to
days.
5 days.
Okay.
Some don't last that long, but up to
Right.
5 days.
Okay. Now, you mentioned the motility of the sperm, the ability for it to move, okay, which also enhances its chances of meeting an egg. But the sperm needs to be in good
Yes.
quality,
Yes.
right? In structure, in development, and all that.
Everything.
Okay.
Yes.
Now, here's the question. Many people want to hear sperm count. How many of them are there in a particular specimen of ejaculate?
Yes.
That's the count,
That's the count.
quantity. Right. And then you can have a high count, but they are all dead or weak.
Yes.
Can you just distinguish between that? Because people want to rush to a lab or a facility and do sperm count and say they are league title holders.
So what we do look for is actually a semen analysis,
Semen analysis. That's what I'm
not
saying.
just a count.
That's right.
The count tells us how many they are.
Okay.
What we want to see is 20 million sperms per mil.
All right.
That's a lot of sperm.
Right.
And if you've got
Hang on, Doc. So that 20 million per mil.
per mil. So
It's an index. I'm coming.
yes.
So what you are saying is that
if you have 3 mils and you are normal, that means we expect to see in your total ejaculate,
Right.
you will have about 60 million.
right. Okay. And what you're saying is what I was going to hit on. So you are saying that is the norm.
That's a norm.
Right. That's
So
the norm.
if you have that number,
Okay.
we believe you have an adequate number of sperm
Okay.
to fertilize an egg.
To fertilize an egg.
Then we look to see the sperm that you have. Are they able to move
7 FM.
and are they able to move forward? Not
Right.
only are they there, do they move forward?
Okay.
So that's what we call an active forward linear progression.
Okay.
That's what we are looking for. So the sperm, when you put them there, are they going reverse, or to the side, or are they progressing?
Right.
So if we count the progressive ones,
All right.
and then we give a score,
Okay.
then we look to see the sperm
And this is all part of the semen analysis.
Then we look to see the sperm. Are they handsome or are they ugly?
Uh-oh.
Because if the sperm has got 2 heads, it's not going to work.
Okay.
If the sperm has got 2 tails, it's not going to work. It means there are genetic problems inside the sperm.
All right.
If the mid piece of the sperm is abnormally shaped, it is not going to give you a good pregnancy.
All right.
So we count those abnormal ones too.
Okay. Spoiled ballots.
Yes.
Okay.
So yes, we can call those ones spot ballots.
Yeah, man.
So when we count those ones, we look for how many are the good ones inside. And then there's a ratio that they use. And they
Valid
say, okay,
votes.
so those are what you call the valid votes.
Valid votes.
So what we're actually looking for overall is how many sperm do you have who are moving forward
Thank you.
and look handsome.
And look okay.
Eh.
Right.
That is the combination. And when we are comfortable with that,
Handsome where they assemble back.
so just okay.
They are okay.
Okay.
Uh-huh. Handsome
okay.
they assemble back.
Or look normal.
Right.
So when we do that, we are like, oh, we think you've got adequate
Okay.
numbers and we think can achieve a pregnancy.
Now you
when
see-
we discover that any of them has a problem, then you have to put in interventions.
Okay.
And those interventions take quite a while.
All right. Okay. Folks.
Or
yeah.
you go around it by you go through the sperm, find the ones which are good, the few good ones, and inject it into the egg.
Is that the sperm washing?
Nope. That is what you call ICSI in IVF.
Oh, yeah, that's the XC, right? That's right. So you're selecting
So you look at all the
one shamin.
and you sieve them and you do
Take
that.
the
Then
best
you,
one.
you find like 20 best ones. Then the 20 best ones, you line them up and say, okay,
Okay.
which one is the most? This one looks good. You take that one and inject it into the egg. That is one.
Ah.
You don't pour it on it. You
All
just
right.
take one
Okay.
and put it inside.
All right. It's like the doctor is giving you a free kick or a penalty. Now score.
Yes.
All right. So please, there's a reason I switched the meter band and the focus to the men, because very often in these discussions, it is missed and it's an unmet need, but we need to clarify these things. All right. There's a difference between your sperm count and a comprehensive sperm or semen analysis.
Yeah.
Okay. Later I'll bring in the specific people who will talk about those ones as well and what we do for the men. Okay. So Doc, I'm so grateful. And now you see why I've missed him, right? That's why I brought him, so that he and I can conceive. Right. This is from Dede in Maryland. Happy prosperous new year. Thank you, Dede. In our part of the world where superstition is rife, most women tend to keep mute till after 3 months before going to see a doctor. What would be his advice, since a lot goes on in the first trimester? This is Dede. Now, hang on, Dede. You see, when you say 3 months, I'd want to break it down so that Doc can give a more elaborate answer. One side of it is, so for how long should we have been trying for me to be worried about conception, right? Okay?
Okay.
Yeah. So we haven't gone anywhere. We haven't done any preconception consultation. But for how long should we have been trying before somebody will say we may or we do have fertility issues? That's one side of it. And then she's also talking about trimester. So now I am pregnant, but I'm waiting till after 3 months with that pregnancy before I come see you. So I've added a bit to Dede's question.
Okay.
Okay.
So the rule generally is that if
99.7
a couple
All right.
are having adequate intercourse, what we all call adequate is having sex 3 times a week,
All right.
ejaculation in the vagina
All right.
for a year,
Okay.
and you don't achieve a pregnancy, then you
3
have
times
problem.
a week times 52.
Yes.
And you still haven't scored.
And you still haven't scored.
All right.
Then that means you have a problem.
Okay.
That rule doesn't apply to those who are older.
Okay.
So if you're above 40, it means you come and see your doctor immediately.
All right.
If you're above 35, we would even say within we won't give you more than 6 months.
Okay. So
See your
anytime,
doctor.
Doc, anytime before this 1 year that we've been doing at least
3 times a week.
3 times. It doesn't mean don't do 7.
Oh, you can do 7.
Okay, right. Thank you.
3
Doc,
is the minimum.
okay, because somebody going to tell their husband, hey, yeah, doc need not to see 3 pair. Right. So minimum 3, right?
And there's a reason for the 3.
Okay.
Is to ensure that no matter when ovulation occurs, there will be sperm.
Say that one again.
Is to ensure that no matter when ovulation occurs,
There'll be sperm waiting.
there will be sperm waiting
to board.
in the vagina, in the uterus,
Right.
waiting to fertilize the egg.
Oh, I like this one. Okay. Charlie, we are going to succeed though. 2025. Conception 2025. Ultimate health. All right. So we've answered that thing which
Now, and then for-
allows us to define
Yeah.
where you have fertility
Yeah,
issues.
yeah.
All right.
So first trimester is basically the first 3 months.
All right.
And in the first 3 months, if the woman has got hormonal insufficiency problems, she may lose her pregnancy. If the pregnancy is in the wrong place, she can have an ectopic.
Okay.
If she's got any other kind of problem that can affect the pregnancy,
Okay.
these are things that you could pick up even from blood pressure, sugar levels, all those things in
All
the
right.
in the first 3 months.
Okay.
If the baby is not growing for genetic reasons,
All right.
you pick it up in the first 3
Great
months.
stuff.
It's really important that the moment you miss your period, you see your doctor
Okay.
so that they start the testing. We want to see that 6 weeks since your last period, we can see a heartbeat and we can see the baby inside the uterus. Usually we do that by ultrasound.
Okay.
We want to see that your hormone levels are normal. If not, we need to support the pregnancy
Okay.
for the pregnancy to be able to stay.
Great stuff.
We want to see that if you have any medical conditions, we start aggressively dealing with it because those problems will exacerbate second and third trimester. You should try and fix it immediately.
All right.
We want to look at your cervix to see if it's starting to open towards the end of the first trimester because those people you need to try and give them reinforcement to ensure that the second trimester they don't lose the pregnancy.
Okay.
The first trimester visit is very important.
All right.
In the event that we find some funny condition that we may need to treat, it's really important then that we start treating you aggressively
Sharp.
from that date.
Sharp.
If a woman, for instance, comes in the first trimester and discover that she's got HIV, for instance, immediately be talking to the FHIG specialist.
Right.
What medicine can we give to this woman so that by the time she delivers, her baby will not get it?
TMTC.
Because if she has a problem, the baby shouldn't have that problem. Otherwise,
Right.
now she has to look after 2 people.
Great stuff.
And not just one.
Right. Hello, greetings, Mr. Nortey Dua and Ultimate Health. Theme, please. It is New Year. Will great things happen to us? We pray for God's grace and mercies. All right. No name there. Let me quickly read a couple before I come back. Good program. This is from Queen Elinam Adenta Snit Flats. Good afternoon and Happy New Year, Norte. How long should the woman... What's this part about Uncle Ibu? How long should a woman be on folic acid prior to conception? What other supplements should maintain fertility? I'm in my late 40s, but currently not in a relationship in the long run. I hope to have children. This is from AC. Hang on to that, Doc. So the folic acid one, and then, yes, how long she should be on that. And then there's another one I want to quickly deal with. Not by nature. This is Kwesi at Sakaman. How can one increase the chance of getting a boy or girl? Does the sex determination chart really work? Right? He's bringing in a chart that allows you to influence Lotto. Right? Doc, chew on that one. Let me just quickly read another one. This one says, hey, I've read yours, you're still typing. Good afternoon, I'm 53 years old. I haven't had my menses in the past year. Is it possible to get pregnant? Okay. So, well, okay. Doc, let's start with this one.
No, let me these 2 questions bring up an issue that causes me great pain and suffering.
Joy.
Women need to understand
Joy.
that the best time to have a child is between the ages of 18 and 34.
18 and 34.
And
Best.
34.
Best scenario.
Best.
Coming from our
Your
consultant.
body is best able
Okay.
to get pregnant without much effort.
Okay.
Once you pass the age of 34, your number of eggs
99.7
drop
FM.
drastically.
Okay.
From 35, the number of eggs drop drastically.
And a woman has a
From
fixed
40,
a fixed
it's
number.
precipitous.
Right.
From 40, it is a precipitous drop.
Okay.
The quality of your eggs also drop from 35. And from 40, the quality drops significantly. By the time you're about 43, 44, almost 80% of the eggs are not good.
Joy.
A woman is born with all the eggs that she has in her
Fixed.
life. It's fixed number from
But
birth.
the men are producing sperms.
But the men continue to produce sperm to their 80s.
One district, one factory. Okay.
And if it is, we can do all kinds of things.
Okay.
We really can do all kinds of things to assist people, even in the late 40s or early 50s.
Okay.
But it must be recognized
All right.
about the fact that this is not the optimal
It's not,
situation.
it's not a good time.
We would have preferred
All right.
that they came before they were 35.
Okay, great stuff. Right. Folic acid, how long?
3 to 6 months is fine.
You should be on that 3 to
At
6
least
months.
3 to 6
Okay.
months.
Can you influence
No.
the chance of getting a boy or girl?
Whether there are all kinds of arguments, yes or no. I'm not the person to speak to. I've got 3 sons. I don't have a daughter. As you can see, if I knew, I'd have done it myself.
Doc, say yes and we collect money and do something. All right.
The only way we can do that is genetic testing with IVF. We do IVF, we test the embryos,
Okay.
boy, girl embryo,
All right.
and transfer the one that is
Okay.
the sex that you want.
Right. Having said that, quickly, Otis question, IVF, and then the other.
I didn't hear what the other thing
I
was.
didn't get it, but there are various methods of
There are various methods
assisted
of
reproduction.
assisted reproduction.
Yeah.
First of all, we have to ensure that you are ovulating. We have to ensure that the cavity is fine. If you're not ovulating, we have to assist you to ovulate. If the hormones are not good, we have to correct all those ones.
Okay.
If the cavity is not good because of fibroids, we have to do a hysteroscopic surgery. We don't cut you. We go through the vagina into the uterus, remove the fibroid or the polyp that is
Okay.
there, and get out.
All right.
You go home the next day and everything is okay.
Okay.
Those are all methods that we can intervene. If your tube is blocked, we have to go around the tube.
Okay.
Trying to open it doesn't really work very
Right.
well. So we just go around the tube, and that is why we do IVF
Right.
for you.
In vitro fertilization.
Now,
Right.
if your tube is good and the cavity is good and you are ovulating and maybe the sperm has some challenges, then we can do what you call an insemination, where we
Right.
take the sperm, we concentrate it, we wash it, we find the best sperm that are inside,
Okay.
and we put that sperm right into the uterus,
Right.
so that the sperm only has to take 10 left or 10
Left or
right,
right.
and go and meet the egg.
Okay.
That's all.
Great.
We've done all the work for the sperm. That is an artificial insemination.
Okay.
It's an easier process. It's a cheaper process.
All right.
Barring that, before that, there's ovulation induction, where we give you medicine. So instead of producing 1 egg, we can give you medicine to produce 2, 3, 4, 5, or 6 eggs.
All right.
In the hope that if the sperm is able to meet the egg, you'll be able to fertilize it, because now instead of having 1 egg and therefore 1 chance,
All right.
we are giving you 3 eggs and
Okay.
therefore 3 chances
All right.
to get pregnant. So those are cheaper methods.
Okay.
But the fastest way to get pregnant, to speak the truth, is the most expensive way, which is IVF.
IVF. All right, great stuff. And we'll go into all of these strategies. All right. There's a reason I selected Dr. Paddy Aite, though his Sundays are pretty loaded. And getting him on a Sunday is difficult. So we have to induce ovulation to give Paddy Aite as an egg in this studio. But there are many other specialists and many other members and practitioners under the Fertility Society of Ghana. So stick and stay on 99.7 FM. Right, so we've answered that one. We've done the folic acid one. How long does it take an egg to stay in the ovary as matured before it declines? We mentioned that women have a fixed number from birth, right? And then it declines over time.
No,
the quality.
From birth, women start losing their eggs.
They start
Yeah.
losing, yeah.
They start losing their eggs. About 2 million when they are born. They're about maybe 1 million in our menarche. They're about maybe 400,000 when they get like 20 years. These are
Right.
just approximate figures.
Okay.
And every month you lose a lot of eggs. At some
Right.
point you lose 1,000 eggs a month.
You never replace them.
You never replace them.
Okay.
You never replace them.
Okay.
So basically, from the time you are 20, you are losing eggs. And from birth, you are losing eggs. From 20, you are really losing eggs.
Great.
But by the time you are 40, by the time you are 35, the number of eggs you have left, the rate of loss
Okay.
increases.
All right.
So you start losing very fast.
All right.
And then by the time you hit 40, the quality of the few you have left
Okay.
deteriorates very fast.
All right. Okay.
So by 43, your chances are pretty low.
Okay. Now I was asking what kind of things affect the quality of eggs and then their maturity.
Biggest problem is age.
Age. All right.
Age.
Okay.
Yeah, I mean, we've got mineral defects, deficiencies. We've got supplements that we can give you to improve the situation. But our biggest headache is age. If you come earlier, it's easier.
Okay. Somebody wants me to fertilize his egg by giving him your number. Good afternoon, Nortey. My name is Bismarck. I'm listening to Ultimate Health on Joy 99.7 FM. Great stuff. I would like to have Dr. Aite's number so I can talk to him privately after my program. Okay, I've shown you where he is. Most of my resource persons, we protect them from bombardment, but knowing where they are, where they practice is one big thing. right? We try as hard as possible to not to should I say transform this into what may seem to be marketing, sales, and advertisement. Ultimate Health since 2003. All my resource persons know me. I know other people do it differently, right? But yes, Elimas. All right, Elimas is at airport. The after turning to Nyaho after the National Service Secretariat.
So opposite National Service, if you're going down.
Just turn left, you're going down,
Yeah.
right? Okay.
You're on the right.
Yeah.
By Uncle
If-
George.
If you know Juniors and Uncle George, the famous legendary watch repairer.
Best watch repairer in Ghana.
That place used to be Cuticles. The next door is where we have Uncle Paddy, right? And he's also in Community 18,
yes.
right?
Same with myself.
Yeah. When you know is it the Block Factory place?
Yeah, the block factory. Yeah.
All right. Okay. Right. So we've
18
done
Block
that.
Factory.
I'll do the deal on the phone numbers, and we know why we do that on Ultimate Health. Any other program can give out numbers, but I'm bound by certain ethical considerations. Okay. All right. So Bismarck sorted. All right. But I will talk to you after the program too, so that you pay me solely. Hey. Good afternoon, Nortey. Happy New Year. Thank you for this education. I'm too old for this, but will educate the young ones. Evergreen Linda. But you're evergreen, Linda. In Osu. Have a great day, Linda. All right. This one says the new year. I'm 46 with bilateral blockage. No, wait. Yeah. My husband is 54 and had prostate cancer surgery. He's out of the country. Do we have a chance of getting a child or children? All right. Thank you. This is Adjoa in Kofredua.
It's possible.
C'est possible.
It's possible.
All right. It's
But-
not a political promise.
No. It is possible.
It is possible.
But when you discuss their options,
All right.
and they'll choose one of the options which are still available.
Okay.
Yeah.
Right. If you see me speeding, it's because I know I have to release Dr. Aite. Right. Please note, doctor mentioned what women should do if they wanted to get pregnant, then men should do. There's a school of thought that when a woman has ovulation, a woman should not eat cucumber. What about she ready to conceive or ready to get pregnant and she eats it? What will happen to her, although she's willing to get pregnant? Hayford in Bato, cucumbers and ovulation, pregnancy.
I have no information.
Hayford,
on
you have
that.
succeeded in confusing my doctor, which is a rare occurrence.
No,
okay?
it's if there's no proven scientific relationship, I can't say.
Hearsay.
I can't.
Yes. There was a
So
malaria.
I'd rather not comment.
Was there a malaria advert which says anybody?
Yes,
Somebody
anybody.
looks at your child with a certain eye.
I used to hear that a lot when
Eh.
I was in Koko.
Right.
And the child has come and said, "Oh, anybody in the
All right. So please, Hayford in Bato, we thank you for
There's no
listening to us.
evidence that
There's
it relates
no
between the two.
evidence that is significant and incontrovertible, right? So please eat. But there are things that doctor was sure on. Please follow them. All right. If you're not sure, go to a health facility near you and get information and support and investigations. Okay. I know many of you, cost is a major issue when it comes to some of these things. We'll deal with all of those things and the different modalities. Years gone by, we've even gotten to even the level of adoption, which is an added option.
But
yeah.
not
Yeah.
this cost issue.
Yeah.
I've told patients before when they complain about cost, and I
Mm-hmm.
told you know something, I'll pay for everything for you. When you have the baby, you give me the baby for free.
All right.
The answer is always no. I said I'll give you 100,000 on top.
Okay.
The answer is always no.
Right.
So if it's so valuable to you, make it a priority.
All right. Dede is asking, is it ethical to select sex using IVF?
Yeah, it depends. If for example you have a sex-linked disorder that is related to a particular gender, then if you want to have a child, you know that you want to have a child that does not have that particular gender. Otherwise, you're going to transfer that sickness to your child.
All right. Okay.
And there are certain conditions like that.
Okay.
Yeah.
All right.
If you say you want only one sex, we'll start asking questions.
All right.
But if you want
Somebody's
a mixture,
asking about blood group.
blood group,
Conception.
people can have sex, children with any kind of blood group.
All right.
Yeah.
Okay. It doesn't.
It's not really a problem. no.
Okay. Right. So does freezing the egg help seize the deterioration in quality so that
Yes.
those eggs can later be
Yes.
inseminated back into the?
Yes.
Yep.
Yes. Egg freezing is something that for women of nowadays, especially those who have put career over reproduction is something
Okay.
they need to consider, so that
Right.
whenever they decide to refocus on reproduction, they have the eggs to be able to do
Alright.
so. Otherwise, we'll tell them that you don't have eggs, then it becomes a whole sad
All right. Okay.
situation.
People are ovulating and ejaculating on the line. Oh. This one says, "My name is Daniel. Please, my sperm looks foamy after sex. What could be the cause?"
Where did he see the foam? At what stage? You've had the sex, you've ejaculated inside. So you saw the foam after it came out. Maybe the foam is from the vagina.
Oh, Doc Mamba. Not tree. But this is why we do this, all right? Because
Very
somebody is seeing
interesting.
something. Note that we said semen analysis, right? It means that there's semen and there's sperm, which is in the semen, right? There's so many things that are going on. You probably see something, you say it is X or Y, and this is the place, 99.7 FM. You can ask it, and my doctor will be kind enough. Even if you see him privately, this is how he is, straight to the point, all right? But we have achieved miraculous success over many years. He has. Many other specialists have. But we try to prevent misinformation, disinformation, which is costing more than even the interventions we are talking about. Yeah? Doc, we've passed 3 o'clock, but any parting words? I know I'm starting a series, which I nicknamed Conception 2025. But any parting words as we let you go?
I look, my day is filled with people who are trying to get pregnant.
Right.
And the most challenging ones are the ones that when you discuss their options, they wish they had made this visit a whole lot earlier.
Okay.
Because there are certain options that are no longer available to them.
Right.
The ability to use your own egg diminishes significantly. There are not many people that you can use their own egg after the age of 40.
Okay.
There are some centers that won't even do it for you after the age of 40.
Right.
Starting early, it's important. You can always do anything you want. You can always build a career. You can always run a business. You can always go abroad.
All right.
You can't always have children.
Okay.
So I think we need to prioritize the whole having children and business and try and do it as early as possible.
Okay.
Second point is that there are solutions. There are people who have got PCOS who feel there's no hope. No, there's hope. There's medication that we can use to correct your situation. We can get you to ovulate. We can get you to ovarian syndrome.
Right.
Yeah. We can get you to ovulate. We can get pregnant. We can get you to stay pregnant. There are people who are afraid of having, they come with fibroids and they're afraid of having surgery. You may have come with a small fibroid that is causing you to bleed. We can do it hysteroscopically. Go through the vagina, go to the womb, remove the fibroid without cutting you, and get out for you to go home.
Right.
But if you wait and you don't come at that stage, and the fibroid becomes huge, big mango, you cannot remove it with high-tech instruments.
Okay.
You now have to use cutlass and hoe.
Right.
You can't use no sophisticated anything. You have to go open the tummy and take out a big fibroid, which could have been taken out when it was smaller with a small cut.
Okay.
When we cut you to take out your fibroid, you have to have a cesarean section.
Right.
When we remove it for you hysteroscopically, you don't have to have a cesarean section when you get pregnant. You can get pregnant. You've got people that we just removed it, they got pregnant and had their baby vaginal delivery without any fuss about it. There are all kinds of hormonal problems that affect your ability to ovulate. There's medication for them. There are solutions for them. There are people who are losing pregnancies because they got pregnant and then they are losing pregnancies first trimester or second trimester. There are solutions for them. It's better if we know before you get pregnant so that we can fix you before the pregnancy comes. Otherwise, once you are pregnant, we are now chasing it from behind. It's not always as successful.
Right.
But there are interventions that can be done. Please come early. See your doctor early. Let them the things be done for you. And by God's grace, hopefully by the end of this year, at the Christmas party, you can come and show Nortey your round bellies.
You see now, you see why
And your newborn babies.
You see why he's my paddy, and he's called Paddy. Dr. Paddy Ayete. He's an obstetrician, gynecologist, fertility specialist, and he also specializes in minimally invasive surgery. He's the CEO and medical director of Elimas Health. They are at airport. We've just given the directions. If you know from Junior's End, I think it's still Junior's End, you just take that turning, going down the from the left turning after National Service Secretariat, right? You can't miss it. They are there. He's also in Community 18, right? Elimas Health. You see a green and white building around the block factory area. Thank you so much, Doc. We're going to be hosting many specialists in this spectrum. Okay, and we'll discuss this conception, and you can realize that even conception itself, we haven't even gotten to the common ones, pregnancy related and menstrual cycle and all those ones, or conception. All right. So we'll get to talk. Many thanks to my producer Ziggy Baidu for allowing us a bit of extra time because our lines were very, very, very fertile. But we'll be back next week and we'll continue this. They can stay on Joy 99.7 FM.